Well, welcome back, everybody. And now going to start session 2 on COVID-19, what needs to be documented. We have 3 speakers in this session. We have Dr. Brendan Murphy, Dr. Lauren Carroll Harris, and Dr. Anthea Hyslop. And it's my great pleasure to introduce Dr. Brendan Murphy, the Secretary of the Commonwealth Department of Health, who began in that position on the 13th of July this year. Prior to this appointment, he was the Chief Medical Officer for the Australian Government, and prior to that, the Chief Executive Officer of Austin Health in Victoria. And most of us will have seen Dr. Murphy many times on press conferences relating to the COVID-19 pandemic. He's joining us today virtually, and so I welcome Dr. Murphy to our symposium. Thank you.
Thank you for asking me to contribute to the UNESCO Memory of the World seminar on the really important topic of our response to the COVID-19 pandemic in Australia and how we got information and what information we relied upon. In the early days, way back in early January, all the information we were seeking was about this virus. You know, what sort of a virus was it? What sort of infection was it causing? How readily did it spread from humans to humans? Where did it come from? Was it a flu? We didn't know that at the time. And what sort of species had it come from, as we assumed it had come across from an animal species? So it was very much an effort of trying to get information out of one place, really, the city of Wuhan in China. Once the Chinese had produced more information and we knew it was spreading to humans. They also cultured the virus and reported its sequence. So there was a richness in the scientific information that came from that original sequencing information. And then it was really a question of understanding further the biology of this virus and how likely it was to spread, how infectious it was, and how likely it was to spread beyond the city of Wuhan into the rest of China and ultimately the rest of the world. So we were looking very much at that daily epidemiology every day. We were looking at where cases of the virus appeared elsewhere in China, and then critically that phase when it started to appear in other countries in Asia. The first cases exported outside of China, and that was a phase where we were pretty much convinced that we were at a high risk of developing a global pandemic. In that context, we then wanted to find out what our own preparedness and preparation was like. So we really reviewed all of our pandemic preparedness, our original pandemic plans. We decided to rapidly modify our standing pandemic plan, which is based on flu, to one that was applicable to this virus, for which we obviously didn't have a vaccine and which had some different properties to the influenza virus. We also then, having seen what had happened in Wuhan, were very keen to look at our state of preparedness as a nation, our public health preparedness, what was our contact tracing like across all of the states and territories, what was our coordination of public health response through the Australian Health Protection Principal Committee, like how effectively could we respond and how can we expand our health protection function, bringing in experts that we had been funding and engaging over the years, academic experts such as virologists, viral modelers, and infection control experts. So we very carefully reviewed all of those public health responses, and we also set out to try and find out more locally about the virus, and the Doherty Institute in Melbourne were one of the first countries in the world, the first outside of China, to culture the virus. In our public health response, we wanted to make sure that we had the capacity to test for this virus, so we rapidly developed the new PCR tests in-house and then looked at expanding our pathology across the country to be able to test at every stage for the presence of the virus. We needed to look at what our public hospital or our health system capacity was like. we had to do some modelling, early modelling we got through the Doherty Institute and others to look at what would happen if we had an uncontrolled outbreak, as we had seen initially in Wuhan, and which we were starting to see in other parts of the world. So we looked at the impact on our critical care, our ventilator beds capacity, how could we expand that. Did a lot of work with the Intensive Care Society and our private and public hospitals and our state and territory health officials to work out how we could expand that capacity. A critical issue early on was the supplies of personal protective equipment, since the city of Wuhan, which was where the virus originated, was one of the major world suppliers of PPE. So we started to look at our strategic medical stockpile, realised again that with some modelling scenarios we could easily run out, as many countries in the world did, and we started strategic procurement of those supplies. Then we started to look at, when it was clear that this was developing into a global pandemic, we had to look at how we could control and prevent widespread transmission in Australia. And we took some very early border measures, stopping people coming from China, then from a range of other countries, and then essentially stopping all but essential international travel both in and out of the country. And those were very controversial measures. They were based on our observations of what was happening around the world and the spread of this virus, even though they were against the sort of conventional dogma for pandemic response that the WHO had portrayed. But those border measures were taken early, and they did help control the size of our first wave. But the first wave also needed to have controls in place from the introduction of physical distancing measures. And that again was a very tricky step to take, where we were putting a lot of people out of work essentially, and stopping a lot of industry, a lot of economic activity to try and keep people at home and stop them moving around. And we needed to understand the best evidence of which of those measures were most likely to be effective at stopping viral transmission, how likely it was that the Australian public would comply with those measures, and how we could monitor them by looking at various surrogate measures of movement, such as driving, traffic movements, Google Maps, using various applications to track the movement of people around the country. At each stage we updated our modelling, and again using the expertise in our academic institutions to map the theoretical and actual reproduction rate of the virus. So then, after controlling the first wave, we then had to do a range of measures to assure all of our governments through the National Cabinet that we were really prepared to reopen up society. And we looked at a range of measures, particularly our public health capacity, our health system capacity, our contact tracing, which is really important, and our preparedness to protect vulnerable people, because it had become clear as we understood more about the virus that the elderly and people with chronic comorbidities were more likely to get severe disease. So we had to look at all of those preparedness measures before we opened up. And then, of course, we did see the Victorian second wave, which required locally in Victoria some fairly aggressive re-lockdown measures after the size of that wave overwhelmed their public health capacity. But at the time of this recording, we're now in a really good position with no detectable community transmission, and we now move into the final phase, which is looking at vaccines and treatments. And very early on in the pandemic, we were unsure whether we would ever get a successful vaccine for this coronavirus, mainly on the basis that previous attempts to make coronavirus vaccines hadn't been particularly successful. But there was huge international effort in this space, and a lot of hope placed on doing vaccines around the spike protein of the coronavirus. And we then had, a couple of hundred candidate vaccines at various stages of development being prepared around the world. And again, there was a huge and complex information gathering activity to find out which of those were more likely to be potentially successful, what data we believed from various different countries that were producing different vaccines, how confident we were about the companies producing the vaccine, the countries where they were producing, and the quality of the data. And so we had a very complex task in selecting vaccines for advanced purchase agreements well before we would normally ever consider a purchase of a therapeutic modality, before they'd even completed their phase 3 clinical trials. So there was a lot of significant guesswork going on, educated guesswork about which vaccines were most likely to be successful. We then had to obviously look also at other treatments that might be available, and we had to set up an evidence task force that, again, based out of an academic institution, to look at all of the potential therapeutic modalities that were being thrown up. Many drugs and treatments that people were believed to be effective, but in the cold light of day turned out to not be effective. But again, a lot of proponents and a lot of people coming up with very different and novel ideas about how to protect people or how to treat this virus. So we had to set up a mechanism to look at all of those potential treatments as well as the vaccines. So the vaccine and the vaccine story, again, is going to become one of the most significant logistical challenges for us, and we'll have to be vaccinating in a way that we've never done before, pulling on resources from right across all the states and territories, all of our health system to capacity. So we are now undertaking a significant body of work to look at those capacity issues. So a very complex health system data gathering exercise, along which we've always been very focused on the economic side as well. We've known that the shutdowns or the physical distancing restrictions had significant economic impacts. We've had economic impacts from the cessation or the significant reduction of international travel, and so government have obviously had to monitor those. We had to often balance the economic impacts of uncontrolled transmission versus the economic impacts of various shutdowns. There were very significant impacts on international trade, and at various stages we were quite worried about bringing in medical equipment to respond to the pandemic, even standard drugs, because there are not so many bellies of aeroplanes coming in, and we had to make sure that we kept our supply lines both by sea and air intact, and again had to develop some significant measures to deal with that. Then of course government clearly had to look at economic supports to those people who were tragically out of work because we closed their industries for periods of time, and obviously big effects on the tourism sector. So it's been a very complex issue. The Health Protection Principal Committee, HPPC, that I used to chair in the early phase of the pandemic, met sort of every day for many months, and we were constantly looking at new and emerging data, particularly the emerging epidemiology, which has become a feature of daily reporting to the community across Australia. So I hope that is helpful to you in your task about planning what data to be recorded, as it obviously is an incredibly important event. We all say it's a 1 in 100 year pandemic, which has had enormous consequences internationally and nationally, and I think there is benefit in understanding why Australia has done relatively well in our response. So thanks for your time, and I hope the seminar is a great success.
Well, thank you for Dr. Murphy for that very comprehensive review of the medical and governmental responses to COVID-19 in Australia. I think that we're privileged to hear from someone in his position of how the response has been managed in this country. And now it's my pleasure to invite Dr. Lauren Carroll Harris to the podium. She is a critic and digital curator who has contributed to Cineast, the Saturday paper, 7am podcast, Guardian Australia and The Baffler, amongst others. Welcome, Dr. Lauren Carroll Harris, to the podium. Thank you.
Thanks for having me, and thanks to the committee for asking me to speak today. I'll begin by acknowledging that I have no expertise in this area. My position here is that of an outsider, I hope an informed outsider. My familiarity is with the arts sector and to a lesser degree the museum sector, and I came across your area of knowledge of documenting cultural heritage in my capacity as an arts journalist. I reported on social history museums and their emergent COVID-19 collections for the Saturday paper and 7am podcast a few months back. My academic background overlaps with cultural policy, but in the realm of film, and I work as an independent curator. So I'm in adjacent fields. Everything I say today is, very humbly made in absolute deference to the expertise that you guys possess, and I hope what comes out of this is some sense of what onlookers who are sideways to your professions are thinking, and some of the expectations that other community members have about what is archived and crucially what is not. The story I reported on was to do with corona-related objects and testimonies, including those contributed by community members to state and national museums, which will eventually result in public exhibitions in time. Just for a bit of context, it connected me to a much larger conversation happening mainly overseas about whether archives and collections are neutral houses of collection and beautiful stops on the tourist trail, or the extent to which they engage with wider society and the very urgent issues of the social world. And that's specifically coming up in the International Council of Museums internal crisis. They're in this new quest to answer a very basic question: what is a museum? And it's a huge controversy in that world. But the local issues I was finding connected to this same issue in a very undeclared manner. When I first started researching, I found that many institutions in Australia were very much focused on material culture and collecting corona-related objects, and objects that symbolised people's experiences, despite the feeling that life had moved online since the lockdown. Physical ephemera, it seemed at the outset, was the go-to. Australia Post, for example, launched a letter-writing initiative called Dear Australia, encouraging people at home to post impressions of this, remarkable time in the form of letters and illustrations to a dedicated mailbox. After digitisation, both the original and the electronic copies will be lodged here in the National Archives for future generations. And then there were very similar initiatives at the State Library of New South Wales, the State Library of Victoria, all seeking hard copy, emblems of the social and economic impact. Sydney's Inner West Council did a similar thing, calling for citizens to tell their own experiences of the new plague and saying that only hard copy responses will be archived for future researchers. So it was these sorts of initiatives that prompted historian Peter Hobbins to argue in a paper published in History Australia in the middle of the year that what unites many initiatives at a national, state or local level is their surprisingly 19th century approach to collecting COVID-19. Much as I adore material culture, he says, as a primary source, it seems an impoverished indicator of our experience of 2020. Surely what we should be donating is data. For all its social and economic dislocations, he said, what truly marks the depths of the pandemic is our bodily immobility and our digital interconnectivity. And so he was calling attention to this odd dissonance between the digital, disembodied, disconnected nature of lockdown and archaic methods of institutional collecting. So that was what I was prepared to encounter when reporting on the story of social history museums COVID collecting, but the real picture was completely different. From speaking to curators around Australia, I found the focus was on documenting the immateriality of the pandemic and grappling with how to digitally document this often fascinatingly banal online ephemera of a locked down, domestic, safe, indoor life. The focus was on the appropriate techniques of collecting such a strange moment in time. In particular, how to collect when first-person research by curators or archivists couldn't be conducted, when travel, face-to-face interviews, research trips couldn't happen. So social history museums, it seemed, were deep in the throes of a digital pivot. the main question that came out of it for me was, as a result of that digital pivot, what is being over-documented? What testimonies are being over-represented? And what narratives will emerge from these nascent collections? I've had a lot of informal discussions and formal interviews with documentary heritage practitioners about how institutional and personal biases would be amplified by the conditions of social isolation, by lockdowns and by internal border closures. And with those involved in the collection efforts, it became clear that they were very thoughtful about the curatorial hazards of collecting in such a time. The hazard was that existing ideological and institutional assumptions would be strengthened because all of the research and the thinking and collecting was happening remotely. My sense is that archives and collections and institutions gather contributions from citizens who they think their audience are. And that can be a little bit self-selecting. It can be a bit monocultural, perhaps class-based, perhaps skewing middle class, urban, educated contributors who already have a strong belief in the project of the relevant institutions, in this case in historicising and remembering and accessing cultural heritage. And some curators raised with me whether the digital data collection techniques were feeding into this issue and producing a less diverse, less representative data set. When I was looking at the kind of outreach projects that institutions were doing, the community members who were contributing their own stories, photographs, notes, the kind of artwork they'd made in their houses for consideration of inclusion in these collections. They wished to return to normal. They were living in major cities. They were, nostalgic for pre-COVID life. They were probably, I'm thinking, most equipped to deal with the crisis. They may have been most protected from the virus. And they were highly connected via the tech and web. And there were questions about whether the data could be skewed and lacking in demographic and experiential breadth. So how are the experiences of the voiceless or those who aren't in close contact already with civic institutions, or maybe are even suspicious of civic institutions? Definitely some of the material I was able to review for my research purposes reflected that. One area of over-documentation that I queried was the experiences and artefacts of those who had the financial literacy and the social mobility to participate in the business response to COVID. There was, in these nascent collections, a celebration of entrepreneurialism. For example, a focus on small business people who'd pivoted to making pandemic-related products like artisan face masks, boutique hand sanitizer. So that was one answer to the question that I had about whose experiences and what kind of artefacts are being over-documented. Because I also work in media, I'll give you a parallel example outside of cultural heritage and documentary heritage sector about similar assumptions that kind of bloomed in quarantine at the beginning. The Australian press predicted that Indigenous communities would be among the worst hit by the virus. And I think that was an assumption based on the narrative of Aboriginal dysfunction and vulnerability. In fact, the Aboriginal health sector's response flipped that assumption on its head, and Indigenous communities had very effective community-controlled health campaigns that sprang into action and were extremely protective. It was, in fact, workplaces and healthcare industries suffering the long-term effects of casualisation and privatisation, in other words, aged care, where COVID-19 hit hardest. But because of the bubble of journalists, they predicted the wrong thing. I also found that documentary heritage practitioners wanted to create stories that emphasised expressions of collectivity and connectivity. They wanted to tell narratives that drew positive conclusions and healthy lessons from the pandemic, and that was kind of declared at the outset of their research phases. If you check out the hashtag COVID Street Archive, used by some professionals doing contemporary collecting, you see that upbeat observations are the focus. And I understand that's a non-institutional kind of informal measure, but it's one example of the thinking and the logic. I wondered if this pre-declared desire would shape the research done and the decisions made about acquisitions eventually. I also became concerned about whether a positive narrative about COVID-19 was actually true, and whether there was space for other testimonies, worldviews, images, artefacts that suggested other experiences. So these are the kind of assumptions that I discussed in the realm of documentary heritage with various curators. Whether, when they were corralled away from the rest of the population, would they be able to run into the sense that, well, many institutions, academia, press, arts institutions that I work for on a freelance basis, unions, public housing, for example, they're weakening, they're not working so well. That's a trend that's exacerbated by COVID-19. So I wasn't sure that you could explain the massive social and political failures of 2020 with a positivist story that curators seem to want to tell. The abandonment of the arts, the abandonment of sole traders and freelancers, contractors, casual workers in the various stimulus packages, the increased difficulty of surviving in the gig economy or as a lifelong renter or low-income person this year. How would curators working from home in large cities be able to see, engage and document the effects of casual workers in regional areas or outer suburban areas, international students, those in housing crisis, those who are outside their own demographic, those for whom COVID-19 has been the final step in falling out of the middle class. So the people I was reporting on were adjusting in the documentary heritage sector their techniques to address the potential tunnel vision quality of recording the present at a distance, to work out how methods of collecting and curatorial practices could get across this big continent and all the non-universal experiences within it. My sense is, as an outsider, that in the early part or even the first 6 months of the pandemic, that was quite a distinct time, and the institutional initiatives and collection techniques and methods were very specific to that time. So that context for contemporary collecting, I think it's probably changed quite a bit now. But I guess my question became, will future researchers see this as a time see this time as one of inclusion, not exclusion, and as a time in which existing worldviews and institutional prejudices were challenged, not accidentally reinforced? Could it be a time, a breaking open of subjectivity and the echo chamber marshalled by the stay-at-home orders? I was really heartened by the fact that the curators I interviewed met my questions with real consideration and without defensiveness. They were cognizant of these challenges inherent in collecting, of how, because of isolation and distance, some subjects will become invisible, and that it's therefore more important than ever to know your own and your institution's biases, vantage points and contexts. These biases really come to fruition not just in the presence of the holdings and the registers, but in the storytelling and the narrative that's put around all of that. But through reporting the story, it definitely made me think a lot about how we're all, contemporary collection experts and all of us, looking at this crisis through our existing ideological lens, and how a self-reflecting data set and its usage can be more easily clouded, I guess, by an ideology that needs a positive story and outcome for the purposes of a more coherent Australian national or state-based identity. So I make these comments today with openness. I completely admit the narrowness of my own reporting, which was on curators inside national and state institutions, and particularly cultural skewing institutions at this particular moment in time. I think society's opened up hugely since then, and the next phase is, not clear. What happens when JobKeeper ends or borders begin to open up? And I also say all of this as someone who's taken great interest and watches with what contemporary collection efforts are doing with real admiration and appreciation and fascination. So thank you for listening and letting me participate in your discussions, and for all the thinking and the work that you're doing.
Thank you, Lauren, for that very thoughtful analysis of contemporary collecting and the biases in it, and skewing that can occur in cultural institutions as a result of the audiences that they are targeting. I'm particularly pleased too that you mentioned the Indigenous response. Something I didn't say before is that we haven't been able to have an Indigenous representative here to speak about their response to COVID, but I have had a communication with the former committee member, Sandy Toussaint from Western Australia, saying that, as you said, the communities have been very protective and have been very rigorous in their management of social interaction to avoid a disaster in communities. And we hope very soon to bring somebody from the Indigenous sector onto our committee to further interrogate that response. But thank you for mentioning that. It gave me opportunity to mention that particular thing, and thank you for your presentation. It's my pleasure next to introduce Dr. Anthea Hyslop, who is a social historian specialising in pandemics. She taught history at the Australian National University from 1989 to 2009, and then before that at Adelaide, Melbourne and La Trobe universities, and specialises in the social history of medicine, and has published several articles on Australia's experience of the 1918-19 influenza pandemic. Over to a presentation from Anthea Hyslop. Thank you very much.
Thanks very much, Ros. This is my first time, so to speak, on this kind of presentation, so forgive me if I'm a bit naive about it. I've called this paper What Needs to be Documented, Insights from the Pneumonic Influenza of 1918-19. As a historian of that pandemic, I think I always assumed that the next great pandemic after that one would reflect its predecessor in several ways, chiefly in how a society handles the practical problem of very large numbers of people falling sick all at once from a highly infectious and often fatal disease. We would see governments in conference, emergency hospitals established, social activities curbed, local relief measures organised, and of course a vaccine as soon as one could be devised and deployed. But also, and notwithstanding the emergence some years back of SARS and one or two other new diseases, I thought that some sinister variant of the well-known influenza virus was still the likeliest candidate for the pandemic starring role. And I took it for granted that Australia would not be able to protect itself as it had done in 1918 by strict maritime quarantine, since travel by air, so much swifter than by sea, could bring a disease here even before symptoms had appeared, and in any case could hardly be controlled in the way that shipping could. I don't recall even wondering if our states would close their borders against each other this time around. That seemed to belong to another era. How wrong I was. I was near enough right about the practicalities of the community crisis, although the initial rejection of face masks for the public use surprised me somewhat. But I was wrong about the rest. All a country has to do these days is to declare that no plane from this or that foreign country will be allowed to land here. And then, when it is allowed, the passengers must undergo compulsory quarantine. I was also wrong about the kind of disease that would be involved, not an influenza of any kind, but instead a mysterious coronavirus for which there was no known cure, let alone a vaccine. In these respects, then, the pandemic of 2020 was reflecting that of 1918-19 far more closely than I'd expected. Their main differences appeared to be, firstly, those people worst affected, this time the elderly and the vulnerable, not the young and fit, as in 1919. This progress, of course, owing much to the challenge of pneumonic influenza itself. Sorry, I've missed a line, forgive me. Next, the much greater capacity of today's medical science to respond to a new virus, progress that owes much to the challenge of pneumonic flu. And lastly, the mortality of each pandemic, far greater everywhere around the world from Spanish flu than from COVID-19, albeit for Australians mercifully less heavy in both cases. So for historians then, I think the questions raised by COVID-19 in Australia will be similar to those posed by the pneumonic influenza pandemic. Where did it come from? How did it enter the community? How was it spread and how controlled? How did governments respond and with what measures? What happened and why if their schemes went awry? How did medical science approach the problem of a new and dangerous disease? How did the community react to the pandemic threat and to the constraints that its management imposed? With COVID-19, as with Spanish flu, the dealings between federal and state governments are a central theme. In November 1918, the health ministers and senior health officials from around the country gathered in Melbourne to formulate a national plan for meeting the pandemic's onslaught. That conference was a single event, and the agreement that emerged soon fell apart over border closures, halted trains, and disagreements about quarantine power. But a century later, it furnished an example of sorts for 2020's National Cabinet. Back in 1918, the November Agreement and its gradual unravelling were well reported in the daily press, and the official record may be found at the National Archives of Australia in formal reports, letters, and innumerable telegrams between federal and state governments. I'll take this opportunity to say that those archives are an absolute goldmine for the historian of Spanish influenza in Australia. I'm hoping that Cabinet confidentiality will not have prevented this year's remote National Cabinet meetings from being recorded both in video and in transcript for posterity, and that the related traffic of emails will survive as well as all those long ago telegrams did. Both then and now, such records reveal much about the dynamics of federal-state relations under conditions of stress and the extent of their respective emergency powers. I can't resist at this moment to give a little sample of some of the correspondence, which might be deemed to be trivial. It was a discussion over £500 that South Australia thought it shouldn't have to pay. It was the difference between a larger sum and a smaller sum, and the Commonwealth thought that should pay the larger amount. Finally, in 1922, it had taken as long as that, although it just came and went sporadically. The problem is resolved by the Department of Defence Secretary advising the Secretary of the Prime Minister's Department to accept South Australia's calculation, quote, because the equipment was hired during a national emergency which may be said to have been a matter of importance to the Commonwealth as well as to the state government. I treasure that understatement. To continue, in 1918-19, maritime quarantine was in the hands of federal authorities, led by Director of Quarantine, Dr. Howard Cumston, and careful records were kept of activities at the several quarantine stations around the country. Yet in January 1919, after several months' impressive achievement, pneumonic influenza escaped into the community at Melbourne, and how it had done so could not be explained. That puzzle helped to delay the authorities in recognising it as the dread disease. This is the Victorian and Commonwealth authorities, because the Commonwealth government was in Melbourne at the time. This delay, of course, then allowing the disease not only to spread in Melbourne, but to travel by train to Sydney before any borders were closed. Today, that puzzle would have been swiftly solved by genomic analysis of viral samples, which might also have traced the probable symptomless carrier, now surmised to have been a person who brought Spanish flu out of quarantine and into Melbourne. But in 1919, any knowledge of viruses was in its infancy, and influenza was treated as a bacterial disease. I hope that the full story of 2020's quarantine failures, whether Sydney's Ruby Princess saga or Melbourne's hotel quarantine breakdown, will be preserved for posterity in the records of the formal inquiries that followed each event. On the other hand, I have no doubt that the role of medical science in this pandemic will be exhaustively recorded. It's been fascinating to observe modern medicine reacting again, as it did in 1918, to unknown and highly infectious pandemic disease. Back then, with bacteriology the new field of achievement, medical scientists worked frantically to produce a bacterial vaccine. Here in Australia, the young Commonwealth Serum Laboratories quickly made it its own, as did state pathology labs. and supplied several million doses in the space of 6 months to a remarkably receptive public. That vaccine couldn't waylay the virus, but it did appear to reduce the impact of secondary infections. Today's medical science response has been able to deploy the enormous benefits of a century's progress in virology. Likewise, with COVID-19, the medical and nursing professions have been able to draw on a highly sophisticated technology and pharmaceutical research, whereas their counterparts in 1918-19 could do little beyond treating influenza symptoms and providing careful nursing, though both these things went far towards helping patients survive. Doctors did try hard to find effective cures, as we can see from the pages of the Medical Journal of Australia of that period, but amid the crisis, most would have had scant time to spare for experiment. The broader community's experience of a pandemic may emerge in various ways. That of 1918-19 may be found in part in municipal records, which recorded relief measures distributed to families whose breadwinners had lost their employment, or worse, who had died. It appears also in letters to newspapers of the time, and or in private diaries and letters fortuitously preserved. Half a century would pass before scholars began soliciting survivors' recollections of pneumonic influenza. How different from now. One of the first was Richard Collier, a British author and journalist who sought responses from around the world to incorporate in a book entitled The Plague of the Spanish Lady in 1974. Among his correspondents were some 150 Australians who recorded their own recorded their own memories or those of their families. Some 15 years later, New South Wales scholars, conducting interviews with octogenarians for Australia's bicentenary, unearthed further memories of the pandemic that followed the Great War. In both sources, these private recollections may have been faded a little by time, but they are unaffected in the sense of being unexaggerated by any sense of their importance as part of a great world drama. With today's pandemic, personal experiences gathered now will have greater immediacy and will perhaps reflect their global context and global importance more strongly, if only because modern news media convey that context so clearly. Indeed, some of our daily newspapers are already gathering experiences of lockdown, hardship, and sickness, alongside family reminiscences of beloved older members lost to COVID-19. Press, radio, television, and the internet are together gathering formidable amounts of information, analysis, and detailed description of this pandemic. By contrast, in 1918-19, newspapers were almost the only public medium, and photographic images from that pandemic were chiefly confined to illustrated weeklies like the Sydney Mail. Media records to historians a research resource of almost overwhelming proportions. In closing, I want to stress that amid the public dramas and private tragedies of a pandemic crisis, society also reveals much about how it functions in more normal times, throwing light on themes that might not seem to bear on the crisis, but are nevertheless significant elements of ordinary life. Adrian Cunningham will fear that I'm wanting everything to be preserved, everything to be documented, and of course historians always seem to want more, distracting archivists to despair. But I simply mean that one of the consolations to a historian writing about a very grim event, or grim in so many ways, is nevertheless the feeling of the better understanding they get of the society of that time in its ordinary appearance, ordinary self. One last thing, I feel embarrassed that I've made it a postscript, but as as Lawrence said, Indigenous records are enormously important. They were not the Indigenous experience of Spanish flu was not well recorded in 1919 in Australia or perhaps elsewhere. Better in New Zealand, I suspect, but then a number of things about the Indigenous relationship in New Zealand have always been different. But here, it's underrecorded. It was a heavy impact. Indigenous Australians fared much worse, by and large, than the European Australians did. And I think their own experience today may well be different in a number of respects. It'll be more varied, I suppose, but it will be no less important to record. So thank you very much.
Thank you, Anthea, for that really cogent analysis of the similarities and differences between our responses in documenting pandemic disease in Australia. Thank you for your contribution very much indeed. It's now time to open the floor to questions, and there are some online questions, and I'll also invite questions from the audience here at National Archives. But there is one question that's come up first of all. I can see here. There's a question for Lauren, Carroll Harris. To what extent is the focus on hard copy material culture a signal of inadequate capacity to preserve digital, presumably heritage? Thank you.
I don't know. I don't really have the expertise to answer that question. Or is it, just kind of institutional inertia? Because actually the reporting I was doing was in institutions that had completely swerved their capacity to document digital under COVID. But I would suggest that you read the article that I kind of cited by Peter Hobbins in History Australia. I think it was a very sharp analysis of gaps in thinking and where this... actually, it wasn't really focusing on where the focus on hard copy material culture came from and what it signalled, but I think that would be my go-to advice if you wanted to look more into that question.
Thank you, Lauren. Are there any questions from the audience at this point? Adrian.
So while Lauren is up there, another question for you, which is, you talked a lot and very interestingly about the difficulties of memory institutions and memory professionals overcoming natural biases and etc. And so that's a problem that we all grapple with every day. But what techniques would you suggest that we could use to minimise or overcome those problems and to try and ensure that our selection and preservation efforts are as inclusive and as representative as possible, where we avoid the sort of silences and gaps where you gave a number of good examples?
Well, I came to wonder if those gaps were actually not so much curatorial or archival problems, but just structural problems in society that were replicating themselves in these institutions. I mean, I think the mere fact of permanent employment probably creates quite a large gap between archivists and the general public. Like, I say that as someone who's in the gig economy, and I sense a widening gap between civic institutions and people who are just out there floundering in the economy, like they're barely in a society. So I don't know. I don't know if it's a question of diversifying staff even, but I think that all the practitioners I spoke to saw it as a question of just something to be extremely cognizant of in their own practices. But I suspect Craig Middleton would have more rigorous response.
Thank you, Lauren. There's a comment also documenting a response to National Aboriginal Community Controlled Health Organisation will be an important intersection of the health sector and Indigenous response to COVID-19. This is actually a comment rather than a question, but if anyone would like to respond to that particular comment, please feel free. I think we all agree that that is a very critical point that needs to be made and to be remembered in our... Anthea, over to you.
Well, it's I really don't have much more to add than what I said, and I should add the caveat that I'm not an Aboriginal history specialist myself, but it's clear to any historian of Spanish flu that very little material has been, well, not so much material, just very little information is preserved about the impact of Spanish flu on Aboriginal settlements, and the fact that they were remote settlements may have saved them in some respects, or it may have made matters worse once flu got in, which it was likely to do. So that has to be much better recorded now, not just remote settlements, but the Aboriginal dimension of Australian society today is huge, and it can't be it can't be forgotten.
Thank you. There's a question for you. Many of us have been anticipating your book on the Australian experience of the 1918-1919 pandemic. Can you update us on progress of your book?
Now, where does that question come from? Probably Peter Hobbins. It's making progress, but it's been slow, and I made the unfortunate mistake of literally falling under a bus back in 2015. That's already 5 years ago, but it did rather take the wind out of my sails. And it wasn't my fault, I might add, it was the bus's fault. But I spent many months in the Austin Hospital, with which Dr. Brendan has a strong connection, and I'm back on my own 2 feet. But that sort of thing, the serendipitous does rather interfere. And I'm proceeding. I think the best answer to give is that I'm carrying on. Thank you.
Thank you, Anthea, and we all look forward to it when you eventually get through to the end of that process. Thank you. Are there any more questions? Shane? You have a...
Wonderful. Thank you. My question is for Anthea. I listened to Lauren's analysis with interest, particularly of the concern that the activity of collecting may reflect a desire to tell a positive state and national story about state and national identity. And I was wondering, Anthea, with your familiarity with the archives on the Spanish flu in Australia, whether you became aware or frustrated at any time by a similar tendency in the collecting activity then, whether there were perhaps aspects to those archives that were too positive or that didn't give you insight into some of the challenges experienced that you were looking for?
Well, in respect of the state and federal governments, the story is more likely to be cast in negative terms in 1918-19 because the November Agreement did break down amid considerable acrimony on all sides. I've endeavoured to explain that the acrimony directed at the Commonwealth government and also Victoria was hardly surprising from the other states, given that it was, dare I say it, ineptitude and dragging of feet in Melbourne that allowed the flu to escape when it did out of that state. It's a long and complicated story, but Humphrey McQueen, who was one of the early venturers into the field of Spanish flu history, suggested that his view was that the the Federation had sort of gone into recess for a time amidst all this acrimony. But I think, it emerged in due course. And so I suppose in explaining the nature of the issue between states, the other states, and on the one hand, and Victoria and the Commonwealth on the other, I'm not seeking to sort of tell a brighter story by any means, but simply to understand the ingredients of it. And it didn't direct itself so much as we shouldn't be in a federation. So I didn't see it as particularly a lasting threat to the survival of what was indeed a very young federation. Today, of course, politicians always try to give us a positive impression of something they do and a negative impression of something that their opponents do. But taking that into account, I haven't felt that it was likely that archivists would be reporting simply the positive. I mean, in relation to 1919, that the archives in the material in the National Archives gives a blow-by-blow account of the breakdown and all the issues that were involved. And it's simply, the material is there, it's collected because it relates to the Prime Minister's office on the one hand and their exchanges with the state governments. So in the archives themselves, I have no sense that material has been selected to convey one impression or another. I think, does that answer the question?
Thank you, Anthea. Kevin.
A sort of a comment for Lauren and the discussion about, particularly about electronic and digital collecting and the extent to which it's going on. And it made me think a little bit, because there's a good paper with lots of thoughtful things that, in fact, as you said, occupy the minds of curators and collection builders all the time, as we strive to find ways to not skew our collection. That, in fact, is so much a part of our remit that we constantly look at that, and we're always interested in sort of responses to it. But then I sort of wondered about the paper you cited. I've forgotten the name of the person, but the article about what the libraries were doing, and you cited the example of the State Library of New South Wales asking for hard copy, but sort of neglected to mention the State Library of New South Wales Social Media Archive, which has a project with CSIRO Data 61 to collect Twitter accounts in order to document that sort of work, which is quite pioneering. And then I thought about the work being done with the Whole of Domain Web Archive, which I'll talk a little bit about in my talk after lunch. And I thought it's an interesting skewing of the way people are reporting what the collections are doing, I think, which in some ways is pertinent to the point of your paper, that we all have unintended biases and skews and we need to expose them. We talk about, in fact, Ros talked about at the very beginning, the register as representing what's happening with Memory of the World when there's so much more happening in the background, but the register is what the public see and the public is reported because they want to tell a particular story. And so I wondered about the way people were looking at what we're doing, because digital archiving is well established in the National Library, in the National Archives, in the National Film and Sound Archives, in the NASLA libraries, and is quite a reliable way of managing it and is quite extensive, but is not noted in sort of the reporting and looking at how we're approaching those things.
Would you like to respond to that?
No, that's really interesting to hear. Yep, I acknowledge that. Thank you.
Thank you. First of all, there was a comment from someone thanking you, Lauren, for your fantastic presentation. And there's a further question. Are National Aboriginal Community-Controlled Health Organisation records preserved with them or with another institution? Can somebody please enlighten the questioner about who preserves the records of the National Aboriginal Community-Controlled Health Organisation, if anyone has the answer to that question?
With the Noel Butland Archive at the ANU Power?
Yes.
Hello, I'm Tatiana Ansupova. I work at the National Archives, and my team is responsible for creating disposal authorizations and selection of records for archives. So I kind of feel like I have to say something. I did have a quick look. Obviously, Department of Health is the relevant Commonwealth government agency. And as some people said, if there's jurisdictional providers, they'll be covered by the regional legislation and rules as well. I just wanted to say on our Commonwealth site, we have very good relationship with the Department of Health, and we have records authorities. And when I talk a bit later in the afternoon, I'll explain what they are, but basically identifying what should come to the National Archives. We both have the pandemics covered and also Indigenous health covered. So whatever will be created by Commonwealth government organisations will fit into the continuation of that gold mine that Anthea mentioned before.
Thank you very much for your response, Tatiana. We have no more questions on the board here. Any more questions in the room before we break for lunch? Louise.
Thanks, Ros. Louise Doyle, National Archives. I just wanted to pick up on Lauren, your comments there in Peter Hobinson's article. Just thinking about collections across museums and libraries and galleries and in the regional space as well. Thinking about collections and I just going to that point of the analogue collection, the invitation to contribute and to collect analogue material in contrast to digital. One of the major factors we all have to think about with collections is how do we use that material that comes into us, those objects, those items, those documents. How do we use them in terms of providing experiences to the public? And in the digital space, there is so much going on in that space, visually, audio, in an audio way, that analogue collections, objects and items that come together with the digital to tell stories is really vital, and it's going to be more vital than ever. And so we had so much streaming, we had so much digitally while we were in ISO that it's going to be a very exciting opportunity for the collecting institutions to present those stories into the future. And of course, for the National Archives, it'll be 20 years before we can provide access to records that come in relation to the pandemic to us. So I just wanted to add that in, that it's important that we ensure that collections work for us, that work for the community in a broader way.
Thank you, Louise. And Anthea, you have a question?
Could I add a comment? Sorry. It occurs to me that there's an irony in that, well, perhaps it's a deep truth, that a lot of the paper records have been, in all sorts of collections, busy being digitised for obvious reasons and for wider public access, so that newspapers and, there's Trove and all the things that can be found there. And there's always the comfort that the hard copy still exists somewhere, whatever may happen to digitising and indeed the whole electronic medium. But it may be that libraries that are asking for hard copy are going to have hard copy in reserve and digitise it for wider access. And it doesn't follow that they're simply relying on hard copy full stop. So they're perhaps not being as old-fashioned and narrow-minded as we thought. Thanks.
Thank you, Anthea. Any more questions from the room? Well, I'll take the opportunity to thank everybody for their contributions. Thank you to Anthea Hyslop in Melbourne, I think it is, Lauren here in Canberra, and of course Brendan Murphy by way of pre-recorded message, and all those of you who've asked questions and made comments either in the room or online. Thank you, and we'll break for 40 minutes or so for lunch and be back at 2 o'clock.